So I want to begin with a land acknowledgement. I'm welcoming everyone here to the League of Women Voters Kitsap Healthcare Committee meeting. And I'm going to ask everybody to mute at the beginning here. But I'd like to begin by acknowledging that the land on which we gather in our homes today is within the ancestral territory of the Suquamish people of clear salt water, or the Suquamish people, who are expert fishermen, canoe builders, and basket weavers. The Suquamish live in harmony with the lands and waterways along Washington's Central Salish Sea, as they have for thousands of years. Here, the Suquamish live and protect the land and waters of their ancestors for future generations, as promised by the Point Elliott Treaty of 1855. Some of us in North Kitsap live on the ancestral territory of the Port Gamble Sklallam, Strong people. For centuries, the Sklallam lived along the Salish Sea, adapting their lives to the natural bounty of the land, rivers, and sea. Here, they preserve the right to fish and gather in their usual and accustomed grounds and stations, as promised to them, as well as the Shemacum and Twana tribes in the Point-No Point Treaty of 1855. So I'm really glad to have you all with us today. I'm going to have the meeting start with a little update, I guess you'd call it, from Jessica Guidry, who all of you knew was our chair and has so many things to do in her life, not least of which is a very busy mom and an employee of the public health department or district? I always get it wrong.
It's district.
Okay, thank you. And Jessica's going to start us off today.
Thank you so much, Lenny. And thank you, Lenny, also for having my back with the healthcare community. It really means a lot. And everyone, I'm a league member, and I am the Equity Program Manager at the Kitsap Public Health District. My position was founded when the Kitsap Public Health Board, which is the governing body of the health district, declared racism a public health crisis in May of 2021. And I'm joining you all from the Port Madison Reservation, which is where I live. I have a couple of updates I wanted to give you all. I know that Lenny had asked me about the comprehensive healthcare assessment. So some of you all may be aware that for at least for the past year or so, the health district's been very involved in conversations regarding the status of our healthcare system here in Kitsap County. Our public health board has had a couple of conversations. And when I say public health board, those are all the city mayors. Originally, it was all of the commissioners, but now I think we're going to be down to one, plus 2 representatives from our neighboring tribes, the Suquamish and the Port Gamble Sklallam. We also have 3 non-elected members. So anyway, they've had conversations about the status of our healthcare system. The CEO of Virginia Mason Franciscan Health, Chad Melton's been to our meetings. We've had fire chiefs at our board meetings. And actually also Susan Brooks Young, who is with the Alliance for Equitable Healthcare and other organizations, has also been at those meetings. So with that, one outcome of these meetings has been that the Public Health Board has directed the health district to conduct a comprehensive healthcare assessment. And for that, we actually we issued a request for proposal for a consultant to do this. And that request for proposal will close on at the end of this month, I believe the 30th. And with that, I just want to quickly share what that healthcare assessment and what the goals are for that. So the health district and the health board are interested in understanding all the capacity constraints and other barriers and obstacles people experience in receiving equitable, timely, and comprehensive healthcare services, as well as the options and opportunities for improving access to care in our community. At least from my perspective, a lot of the conversation has been hospital and ER access and OB access, and some discussion about access to end-of-life services and reproductive health. So I think they are looking at this more comprehensively. I do not know how many proposals we've received, but I know I've personally shared them with some consulting groups that I know of, and I know that our staff have shared the RFP with groups like the like the University of Washington. So we're optimistic. So hopefully, the next time I give you all an update, I can tell you how many proposals we've received. Now, saying that though, the health district does have a team of epidemiologists, so data crunchers, and we have looked at healthcare capacity as well. And I've shared the data, with this committee in the past. Something that I'm also excited about is that the health district is also doing a new community health assessment. And I feel like, and this was previously called the Kitsap Community Health Priorities. And I feel like, Pam, both you and Becky, maybe someone else, joined us at the health district years ago when we had a meeting about priorities. So when I say a community health assessment, that's when our health district team pulls data on a variety of topics, demographics, economics, injuries, deaths, chronic disease, communicable disease, childbirth and infant care, things like that. So this is going to be a report that will be pushing out with the community, and it'll also include stories and what we would call qualitative data. So actual people sharing their input, not numbers necessarily, from other assessments, like the Kitsap Community Resources. They've been doing their community needs assessment, and they've been doing focus groups. Also, we've been working with the hospital system on their assessment. So this final document will just have lots of information on various topics. It'll have hard numbers. It'll have stories from our community members as well. And that, I'm guessing, the final will be complete by the end of this year. But the reason I'm giving you all this heads up is because probably in around August, we will be having what's called a data summit, where we will invite community organizations, including League of Women Voters, to look at the data with us. And we'll share highlights from it. And from that, also talk about what may some priorities be for our community to address in that data. The community health assessment will also include, I forgot to mention, access to healthcare as well. Stay tuned, because, as I've got multiple motives, because I am also a league member, but definitely stay tuned, because we first want to get our community members involved by looking at the data and giving us input on the data. And then there'll be a final report. We'll also have what are called data walks, where we'll actually go into the community and have a couple of meetings, and we're hoping to have it geographically dispersed, and actually going out to the community, asking for data and making it more accessible. So we've got that coming up with the community health assessment. And the idea being that closer to the end of this year, the same group potentially who attended the data summit will actually talk about creating what's called a community health improvement plan. Because it's not enough for us to just look at data, right? We actually have to do something about it. Otherwise, we're just collecting data just for the sake of collecting data, which is definitely not our goal. So we've got that on the that's coming up. And then I guess the last thing I will actually two things. So I just wanted to just clarify, as I mentioned before, that our public health board now is complete. I think it was 2 years ago now, the state passed a law that required us to expand our board to include non-elected officials. So I'm really excited, because from the Suquamish tribe, we have their health director, Steve Kutz, who is actually a Cowlitz tribe member. We have Jolene Sullivan, who is both a tribal member and the health director also of Port Gamble-Sklallam tribe. And then we have our other three non-electeds, Dr. Mike Watson, who is with Virginia Mason Franciscan Health. We have Dr. Tara Kirk-Sells, who is a researcher. She might be affiliated with UW, I'm not sure. And then we have Drayton Jackson, who's with the Foundation for Homeless and Poverty Management. So anyway, a lot of interesting things. And I'll say from my perspective as an equity program manager, we have launched what's called the Kitsap Health Equity Collaborative. And I know some of you are already aware of this, but it is our way, one mechanism for the health district to work with community organizations who serve communities experiencing inequities, not just our communities of color, but also our LGBTQ plus communities, our communities with disabilities, our communities who are formerly incarcerated, to look at what drivers to health inequities. So what social issues that cause health inequities that cause some people to be healthier than others. How can we address that together? And this came about because in that resolution declaring racism as a public health crisis, there were a whole list of commitments that the health district would do. One of them was to actually hire full-time people to do this work, which makes a big difference as opposed to having like 10 other hats. The second thing is that we would co-create solutions to systemic inequities with our community partners. And that's where this health equity collaborative comes in. And we're going to be having our second meeting next week. And we are going to be looking at the barriers to good health in our communities. I think since we have so many different perspectives, it'll be really interesting to see what barriers our participants will identify. And then we're going to look at, which barriers do we want to address and what assets in our community address those. So I'll definitely be happy to share more about that. But one thing that I will also say is with the collaborative, one way that this model is different than I think how the health district has operated in the past is that we are compensating people for their time if they're not being paid by an organization. So, and this is to be equitable. Historically and currently, government agencies ask community members to give input without compensating them. Yet, when we get consultants for things like strategic planning, organizational development, we pay them. So this is our attempt to lift the voices of our community and also recognize that community consult, we see that equally. I personally see that equally to the consulting that we get from, like the RFP I was telling you about, like the community health assessment. We can only compensate people though who are not being paid by their organization because per our rules, it would be the person would be double paid, if that makes sense. And so we're giving gift cards to compensate because we cannot give money directly. Otherwise, we'd have to have a contract and, they'd be a contractor and all that stuff. But besides that, a lot of exciting things happening at the health district. And if y'all are ever interested, the Kitsap Public Health Board does meet monthly, except for the month of August. And they meet the first Tuesday of the month. And I believe the time changes, but if you go to the Kitsap Public Health District's website at kitsappublichealth.org, you can get more information about those meetings. They're very insightful, and especially with this expanded board. And I don't know if any of you watch the board meetings, but I feel like already they've made an impact on how robust the conversations are. And with that, that's really all I had to update unless anyone had any questions.
Got to unmute myself. Yeah, Anne, go ahead.
I have a
Thanks,
question.
Jessica.
Yeah, thanks, Jessica. I have a question. In all of these studies that you're talking about, is there data being collected on the impact of the closure of healthcare facilities at Bangor? Like the closure of the ER and the obstetrics and the,
So Anne, you're talking about with the scope of Naval Hospital Bremerton
right.
Decreasing over time. I have not heard of any like official studies, but I've heard people voice their concern about it. And especially considering, with my bias, in terms of like their obstetrics and their baby care. But I don't know if there's been any official data, because I think people may also point to, correlation versus causation, if that makes, and the difference being, well, you can link certain outcomes, but you can't prove that it was caused by the closure of Naval Hospital Bremerton's ER and other things. So no, I've not heard of any study, but that doesn't mean it doesn't exist. I haven't heard of it.
More in terms of the impact of numbers on our healthcare system in Kitsap County.
Oh.
The numbers that are coming to the ER that actually would have gone to Bangor, would have gone to the hospital there, or the numbers I've heard. I mean, they've done articles about it in the paper about the lack of, OB care and that kind of thing. And all of the women that were having these babies at the hospital. I think it's unconscionable that they close those services, that they should carry their burden, that the Navy should have those services available for their personnel. I in particular, I have Navy, retired Navy family members, and it was really convenient for them to go there to get their birth control or to use the ER or whatever. So,
So,
yeah.
and I can definitely ask our epidemiologists because I imagine what they could maybe do is figure out the timeline of how the Navy has closed services. Like, oh, they closed this, they closed the ER in this, in this
Right.
month. They
Right.
closed that, and they might be able to then put that timeline against trend data.
Mhm.
But I've just not heard that analysis. But I can definitely ask.
I
And
definitely think that needs to be in that study, that long-term study. that you're
thank you
doing.
for that. I can definitely give that input. And one thing I'm ignorant about, Anne, is I don't know what conversations the health district in particular has had with the Navy about this. I
Sure.
know that I know that we've got employees who meet more with operations staff about very specific topics, but
Mhm.
I don't know if the Navy has been involved because I haven't seen them at any of the board meetings. So, but I don't know if they've been invited. So I can definitely ask about that.
Great. I would really like that information.
Thanks, Anne. And I'm going to ask, unless people have questions that need to be answered right now, I kind of want to keep this meeting moving. But that's that's one of the things that I had wondered is, so how are we going to know what the impact has been of the Navy's actions? You would think it would be significant in certain areas and in certain kinds of healthcare issues. So I think it'll be great if we can call that to the attention as they do these evaluations of that the public health district is kind of leading for us. Are there other questions that are really urgent for Jessica? Remember, this is recorded so we can share it. Anne, Blair, the other Anne. You're muted.
There was a general question put up, or not question, but comment about the fact that Rob Gelder was holding some meetings. And I just think that if anyone missed that, we should go ahead and I'm sorry, I don't recall who mentioned it, but I think that's an important piece of information. So
thank you. Yes, that's in the chat. Carolyn posted that.
good. Thank you, Carolyn. Well, that was, I didn't realize who'd sent it, but I think that's really important information. And not all of us think to go look at the chat all the time. So thank you.
Right.
Yeah,
So
and
yeah, we'll
to
make
say-
sure that is called out in the notes. Thanks, Carolyn.
Yeah, and it's not an open meeting. It was an invite, for stakeholders. And I know that Mayor Erickson is going to be there, and I'm not sure who else, but I think it's an important thing. And it's not really, it's more, I think, gathering information because so much has been talked about recently about public hospital districts. And just one comment is Dr. Hebard, Hebard, gynecologist, who is one of the very few OBGYN providers in Kitsap County, talked at was it the last health board meeting or the one before that? And she just, if you should look at it, or actually I could send out, I excerpted that video, but she talks for about 5 minutes or whatever about the cliff, the crisis, that we're facing of GYN care in Kitsap County. We have so few OBGYN per 100,000 residents, and many of them are about due to retire, and her private practice with their doctors are having a hard time even meeting, getting enough, having enough revenue to pay their costs. It's a crisis, and it's more than a crisis.
Yeah, and those are the kinds of things that the health committee will be looking at in future meetings. I'm hoping to have Dr. Hebard come and talk to us. So we'll be getting, while other groups are also getting information on the healthcare situation. We did a panel last year. Most of you remember. If you didn't see that, we have the video of that panel that we did in March, I think it was, which was about reproductive health in particular and end-of-life care. At that point in time, Peninsula had just, Community Health Services had just hired a couple of OBs, and that did not last. So that's one of the drivers of the crisis. So we're trying to inform our members so we all can ask intelligent questions about this. I just found out that the Sklallam at their health clinic have a new OB starting in December. So that's useful for S'Klallam tribal members. And it helps whenever you can bring somebody in who's going to serve a certain population. They have a new OBGYN doctor on their healthcare staff there at their clinic. So without a lot of other conversation at this point in time, I'd like to go ahead and see if you're all my guinea pigs today. I have a new way of running videos, I hope. So let's see if I can get this up. And whoops, I made a mistake. Hang on, I want to share screen. And it looks like somebody is asking to be readmitted, so I'll do that first. So I'm going to share my screen to show the video from the public hospital district. And if I do this right, you should all be able to hear it. Let me first see if I can make it bigger. Can everybody see it right now? If anybody is not seeing the video, let me know. Like wave your hand or something. Okay, now let's see if I can make the sound work. This is the $64,000 question. So. Yes. Thanks, Becky.
I was gone 7 years to school and lived here the rest of that time. My wife and I run a bed and breakfast on the edge of town. We take care of, anybody that comes to visit, people that are working here, fishermen, people that are coming to visit the national park, and recently Twilight fans coming to see the town fort. Forts has a very delicate fabric, I guess, of how we exist here, both in jobs and in the services that are provided to the town. And without a hospital, we have 60 miles to go to Port Angeles or 100 miles to go south to Aberdeen. If we didn't have a hospital here, we'd be losing people.
Well, I think that's one of the important aspects of this community. Here you are in what some people would say is the middle of nowhere or a very rural area, and also hospital clinics with a lot of very qualified physicians and practitioners to care for us. So we feel quite lucky.
The great thing about a public hospital district is owned by the patients and citizens. We're a nonprofit governmental entity that's focused on providing the best possible health care for our local community. And it's very rewarding for our medical staff and our employees because our mission is very significant for us. Hospitals that cover 300 square miles of northwest Fifth County.
We are a 25-bed critical access hospital, so the only hospital in Jefferson County. Salt Lake is a small community. It's one of the communities included in the district. We're a 42-bed facility. We do long-term care. That's our specialty.
No matter whether it's a public district hospital that's in an urban area or suburban area such as we are, or in a rural community, it has its differences and its special nature, but there is a common theme.
As a public district hospital, we receive taxes from our district residents, and that's the difference between being a public hospital. So roughly 5% of our revenues come from a tax base.
Those funds help us to do amazing things in our community that otherwise wouldn't exist, because there is no sound business model underneath of them to allow them to exist, and yet they very much do exist. Senior services, free from bereavement, the ability to have a 24-hour nurse call center.
I would think that a hospital out here, if it wasn't a public hospital, would be challenged to financially manage itself. Say a privately held hospital, I think probably what would happen is there would be some clinical coverage, but there wouldn't be the full-scale hospital that we're so blessed to have here.
Growing up, I can remember times with 105-degree fever and, mom bringing me down and when a mother is worried about her child, then they need a place to go to. So this is it.
The hospital district model is basically a model that allows the local public to be involved in the leadership, provide a board and leadership and community support to the hospital. I'm currently the president of the Board of Commissioners. I'm a commissioner for Public Hospital District number 2 in Pullman County. Invited the general public to show up, make sure the policy is set, see to it that we're running legally. We have fiduciary responsibilities of various kinds. There's a different connection that our commissioners have compared to other organizations I've found, where they not only help govern strategy, policy, selection of the CEO, but they are representatives of the community, and it creates just an additional but very powerful connection.
We're constantly talking to our community and getting feedback from our community. One big thing is our Squam residents, which are about 16 miles away from the hospital, really wanted some kind of urgent care walk-in clinic. So if they needed urgent care, they didn't have to come all the way to the hospital and wait in the emergency room. So a couple of years ago, we started a walk-in clinic in Squam, and that's been very successful.
The hospital is such an essential component of our social fabric that it feels good to have something to do with it, to have some ability to control what happens.
Together with Olympic Medical Center, who is also a public hospital, we were able to join with them as well as Forks and form a coalition. With this coalition, we were able to develop improvement in buying power as far as being part of a larger buying group and access to upgrade in our medical information technology.
District 1 and District 2 have a interlocal agreement which spells out some services that they can provide to each other.
I've been fortunate to be able to travel across the state and across the country and talk to peers in emergency medical service and see other systems for areas of this size. And what my experience has shown me is that because of the relationship that we have between Hospital District 1 and District 2, we're able to provide better services and a higher level of patient care than would otherwise be available if that partnership did not exist.
Healthcare is really local, and having a local public hospital district working with the entire community, including the other healthcare providers in the community, that's the way healthcare reform is really going to happen. Making this healthcare delivery system better isn't going to happen in DC or even Olympia. It needs to happen boots on the ground in the community, working with a variety of partners.
There's many moving parts to the Affordable Care Act, and we're hearing there's a lot of new terms and new concepts being brought forth, including accountability and the accountable care organization and payment for performance. My conclusion about a public district hospital, in addition to things we already talked about, it is the essence of an accountable care organization. We are an ACO even before that became a popular term.
That adds a level of engagement that makes a difference for our patients. Public hospital districts are very unique. I think in rural areas, given the economic pressures, a much larger population of poor patients and elderly patients and uninsured than urban hospitals, and I think it requires unique dedication and focus to meet the community's needs.
My mother, in the last year of her life, spent a year here at Forks Hospital long-term care, and it was so nice for us because she was in Forks, where we could visit her every day, evening, morning, whenever we wanted, instead of making a long 60-mile trip to Port Angeles. And because the hospital is under the jurisdiction of a board of directors that are elected, they're very accountable to the needs of the community. And one of those needs is the long-term care. And so I just think that she got the best care possible. I consider all of her caregivers a group of angels, and we just couldn't be more pleased. And I don't think we would have that without this facility here.
All right, let's see if I'm still unmuted. I guess I am. So as you saw at the end, that video is from the Association of Washington Public Hospital Districts. And it's been great for us, I think, because I've watched it, I don't know, half a dozen times now. And it really illustrates the whole range of care that is provided by public hospital districts. And I confess, before I started looking at this, I thought it all had to do with hospitals. And that's one of the things the video, I think, really illustrates about their local responsiveness. So I want to move next. Welcome, Cynthia. Cynthia Stewart is a league colleague of mine, and she has indicated that she's from Tacoma League. She's been around a variety of different places, and she is going to run our PowerPoint today because she's better at it than I am. And she develops great PowerPoints. But she not only is a league member and has been very active in the league, she also worked in government for 30 years, including on the King County Council, the staff part of it, working with special purpose districts. So she has a lot of expertise in particular in the area of special purpose districts. And as you probably know by now, public hospital districts are a special kind of a special purpose district. So Cynthia, if you're ready, I hope I have it so that you can share your screen, and welcome.
Thank you very much. Let me see here. Okay, so I guess I'm going to start by elaborating on my background just a little bit, but I also want to say right up front that this is work, I'm reflecting work that was done by Nancy Field, by Marilyn Courtney, and Jody Disney, who are all here. So I am not taking credit for this. I want that to be very obvious. So let me see if I can get myself to the slideshow here. So I have worked in government for about 30 years, most of it as management, and I spent 8 years with the King County Council as a section manager dealing with intergovernmental issues, one of which was, in fact, special purpose districts. I also worked later, after I retired, as a consultant and helped to set up a number of special purpose districts. So I've done it on both sides, from the government end and from the formation end. I also have worked to some extent in government as on healthcare issues, and I have been extensively involved in the League of Women Voters for quite some time. So I'm coming to you with some league experience as well. So I think a lot of this PowerPoint is very redundant to what you just saw in that video, but I'm going to walk you through it anyway, just because you can have this later and take it away with you. So public hospital districts are, in fact, special purpose districts. They have a particular chapter of the RCW that pertains to them, which is 7044. The way a district is formed is that the voters have to approve it. They approve the area in which the district is going to be formed. They approve the basic services that will be provided, and they have to have some sense of what the tax obligation is going to be and how it's going to be governed. The Board of Commissioners is elected by the public as well. Once a public hospital district is formed, it is a governmental entity, and it is subject to all the state regulations that provide public accountability, such as the Open Meetings Act, the Public Records Act, and so forth. And public hospital districts, as Lenny just pointed out so clearly, are opportunities to provide a whole range of healthcare services. It's not just hospitals. I think maybe at some point we should consider asking the state legislators to change the name, because it's really misleading. There are 58 districts, pretty evenly divided between Eastern and Western Washington. And the services, these are some on this slide, and then there's some more on the next slide. They range from hospitals to emergency health services, skilled nursing facilities, long-term care, clinics, wellness services, and behavioral health services. So the range is really huge, and it is really a matter of what the public needs and wants and is willing to vote for to put in place. So here's a map that is of all of the hospitals in Washington State from the Hospital Association, but the circles are around the ones that are provided by public hospital districts. So you can kind of see how prevalent they are around the state of Washington. A lot of different counties have at least one, some have multiple, not just Kittitas that you saw in the video. So they're not uncommon, and but they're not well understood. So the kinds of things, the powers and authorities that they have include surveying what's going on in the rest of the community health-wise. They can lease or purchase land or facilities and equipment, whatever it takes to get going and to operate. They can contract for services. They can borrow money. They can tax with a property tax levy, which would then be the debt service payment on the bonds if they borrow. And they can do an additional levy with additional voter approval. They can sue and be sued, and they can hire healthcare practitioners and otherwise employ people that are needed for the services that that they decide to have. So one of the questions that people have has to do with how much would this cost me? And in the public health district education committee that I'm participating on, and the other people that I mentioned, we didn't have a way of really giving you that very specifically, but came up with a couple of examples. So in Grays Harbor, the levy rate is 47 cents per thousand AV for one public hospital district and 53 cents in the other, which translates into the numbers here, $141 a year for a $300,000 home in one of them and $159 in the other. In Clallam County, similarly, about 41 cents per thousand in example one, which is $121 a year, and 57 cents per thousand in the other, 171. So that gives you a sense of what it would cost. And when I don't have a good graphic example here, but when you pair that up with the other property taxes that you pay, it's probably not that great of a proportion. Now, a lot of confusion exists, and including in the League of Women Voters. And one of the reasons that this is worth talking about is that there's a public hospital district and then there's public health district, and they are not at all the same. So public health districts, every county has one, and the board is appointed by the local elected officials, either the county council or the county commission. It's governed; those are governed by RCW, different RCW 70.05, 08, and so forth. Public hospital district, in contrast, is obviously not in every county, although there may be more than one in a county. And they are created by a specific vote of the public. The commissioners are elected and not appointed. And the RCW by which they're governed is specifically RCW 70.44. In terms of additional differences, public health districts are charged with promoting community health, helping prevent disease, and building healthy communities. Typically, that does not any longer, in many cases, include direct health services. So they do analysis, epidemiology. They can provide the women, infant, and children services. They typically operate, regulate food safety and enforcement, environmental safety related to water quality, sewer, septic, and shellfish, and those kinds of things, and infectious disease controls and immunizations. And those are typically, other than a very few, are not direct public services. And this is something that actually shifted a little bit in the recession in 2008 through 10. A lot of counties had to cut back on the money that they had available and could spend. And so a lot of them reduced their direct services in the health departments out of financial need. In the public hospital district, there is not a prescription, and this is repetitive at this point, but there is not a prescription for what services are provided. And they can provide a wide range of personal health care, which I've already repeated here, so I'm not going to say that more. So how do you form one? So the RCW specifies that there has to be a petition signed by 10% of the voters at the prior general election. And then that petition goes to the county commissioners or county council, who would presumably approve putting that on the ballot with that petition. And the district boundaries would have to be specified, and they could be countywide or a part of the county or a multi-county. And then if the majority vote is more than 40% of the votes cast in the preceding general election, then it passes. And then at the same time, commissioners are elected, and the proposal would specify whether it's 3, 5, or 7. Now that has, that's a pretty broad process there. That doesn't really tell you what people are voting on specifically. And I want to contrast that with some other special purpose districts where there are very clear regulations about what they have to provide on the ballot or before the ballot. So other examples of special purpose districts are library districts or park districts, flood control districts. There are surface water management districts. There's just a whole range of, there's transit districts, there's zillions of districts. And these are all done in the same way that I just described for the public hospital district, in the sense that the boundaries are established, the purposes defined, and there's a tax established that the voters approve to fund the special purpose district. But usually there's a bigger process than that, which I'll talk about in a minute. So typically, there's a proposal somewhere in the community, and part of the questions that I've heard around this whole topic are, well, who gets to start this? Well, it can start anywhere. It can start with people who see a need that want to have the community deal with it. It can start with a private nonprofit or any institution or body that decides that they want to start this initiative. But again, the goal, if you want to have one, is to get the petition signed by enough voters to get it on the ballot. And that takes some education and information that the voters need. The documentation that's required for some special purpose districts includes doing a needs assessment and a financial feasibility study. And in some cases, that's quite extensive in terms of time commitments. It typically costs quite a bit of money. And however, what comes out of that process is information that the voters can have about what is it going to cost to do what we think we want, and can we afford it, and how will it get paid for. So in a hospital district, most of the money actually comes from insurance reimbursements or fees, not necessarily from the taxes that the people pay to get it started and maintain it. The taxes are typically quite a small percentage, but people won't know that unless there's some kind of a study and analysis provided to them. That analysis is, again, it's mandated in some cases, not in others, but it helps to gather community support. So usually there's somebody in the community that starts a campaign and then starts figuring out how to make this happen. So then there's also a campaign after it goes on the ballot, or there's a decision to put it on the ballot. So whoever is sponsoring this will typically conduct a campaign very intensively around the ballot issue. One of the things that League would do would be hold candidate forums for their for the commissioner candidates, they might hold an issue forum related to ballot issues or whatever. So the league could have a role in this in addition to providing public information about the whole concept. So I tried to do a timeline here to reflect what my experience has been in the past about getting this to happen in other kinds of special purpose districts. So identifying and documenting the need, that's really a community needs assessment. That can take up to a year, depending on what process is used to gather the information. But somebody who's promulgating this would need to figure out how to do that, what the process is, how to explain it to the people from whom the information is being gathered, and then collate the information and describe it in a readable, understandable way. After that, then there has to be typically a financial feasibility study, which then analyzes if this is the need and we want to solve that need through a public hospital district, or in some other cases, a Parks district, what would it take to pay? What would that cost? What do the facilities cost? What's the operating cost? What are the maintenance costs over a period of time, and so forth? And then how would that be funded? As I mentioned earlier, who are the parties that would contribute to the cost of that? And then what would the taxpayer's obligation actually be? That information then is, again, as I mentioned earlier, used to gather community support, or in some cases I've been involved in, it's used to say, well, this isn't feasible, we can't do it. But you wouldn't know if it was feasible if you didn't have that information. And then going to the ballot issue, the campaign is usually pretty lengthy, both before it gets to the county commissioners and then between the establishment of the ballot decision and the ballot itself. So typically this process is usually more than 2 years and take quite a bit of work. Now, if there's a community need for healthcare that isn't being met, and I can think of a number of circumstances where that might be true, this is well worth it. It's well worth it. If the public ends up voting for a public hospital district, they have an entity that is public, accountable to the public, and they own it. But in some cases, I've seen feasibility studies that resulted in people just saying, well, this is not going to work. So I just felt like I needed to share both sides of that question, because if you just assume one and not the other, then it's not realistic. So the services can begin after the tax collection starts. There's a period of time to set up that system. So there's a lag period between when the ballot issue is approved and when the money starts coming in. The upfront cost of the feasibility study and the analysis and the needs assessment and all of that can be funded in different ways. It can be a loan from somebody. It can be a campaign that generates contributions to do it. The county could fund it. There's all different ways to do that. But in terms of implementation, there's a very significant lag time while the money is being accrued. The commissioners also would typically hire a consultant or executive director, and that takes some recruitment time and organizing for that to happen. And then there have to be agreements for everything from facilities to contracts with staff and so forth. So that whole system has to get set up, and that implementation period also takes some time. And again, it's very likely well worth it if there are services missing in the community that can be handled this way. But it's important for people to realize what it takes to make this happen. So I've just put some resource information in here, and I will give Lenny a PDF of this to share with all of you. And I think that's all I really have to say today, unless I can answer some questions.
forgot to unmute as usual. Thank you so much, Cynthia. If people have questions, we have some time for that, but it looks like Anne has a question. But I also want to remind people that we do have a current public hospital district commissioner with us. So we want to give Tricia some time too. So Anne, why don't you unmute and ask the first question? Anne Pyle, sorry, two Anns here.
Right. My biggest question is, how is the building funded and how long does that take to do that? Do you have to wait for the tax money to come in, or you can't provide services so you're not getting any insurance? That's my basic question.
Well, part of what the board and the CEO have to do is set up a budget. And it depends on whether you're talking about building something or leasing something. And typically it would be a lease to start with maybe a longer term proposition to build something. The way you budget in a public agency is you assume a certain revenue flow. You assume a certain number of dollars are coming in from various sources. And then you can use that, you can obligate that cash flow through a lease or a loan or something like that. And so Tricia's doing a lot of nodding, so she may want to supplement my answer here.
I'm agreeing with everything you're saying. That's the purpose of my nod. I'm just the example is Pullman's hospital. We were Pullman Memorial for since the 60s. We leased space on the WSU campus. So that's how we got going. And then after 3 times, we went out for a bond that enabled us to build a new hospital at a different location. So what Cynthia's explained was exactly Pullman's experience.
Pam Hammond has a question.
You muted.
Unmute, Pam.
Are you there now?
Yeah.
If a community decides on a particular service through the hospital, public hospital district, and then decide they want another service, do they have to start all over, or can the original setting up can expand to cover another kind of service that's established or identified later on?
So
That's a Tricia question.
Tricia, you might be able to answer that from a public hospital district perspective. What I'm familiar with and others is that the commissioners then can make decisions about what other scope they want to include. But if it requires additional funding and they have to go out for a vote of the people, then that's a de facto public approval.
Thank you.
Oh, yeah, that's exactly how it works. Let's say we wanted to add sleep medicine, which we have done recently. The Board of Commissioners, through a strategic planning process, would entertain that idea. And then there would be a matter of recruiting a medical professional that could manage that service. And that's how it would come to our community. And there's just so many examples of how a specialty service, and that's been a huge priority in Pullman, is to invite the specialists to come and provide care. And so oncology and cardiology and all of those kinds of specialties, it had to go through the Board of Commissioners after an exhaustive feasibility study, looking at space, looking at finances. So that's how it comes, but it definitely goes through the board. However, we are the conduit to the community, and we hear the voice of our citizens, and we hear why don't we have rheumatology? Why don't we have dermatology? So then the board, as a commissioner, I feel obligated to bring that forward to any planning process that the hospital does. So then that can be part of what we consider on an annual basis as we expand. So that's typically how it works.
Yeah, before we take the next question. Tricia, are there other things you want to kind of let us know about? You talked about being responsive to the community, but could you just kind of give us a thumbnail sketch of what your life is like as a commissioner?
So I've been a commissioner. I just realized I'm going on my 19th year of being a hospital commissioner, and everything that was depicted in the video is the way it works. We are elected officials, and if you don't have an opponent, you're basically, if you get enough votes, you're going to be reelected. I did have an opponent last year, and I'm also a league member. And so the league offered a forum. So my opponent and myself were able to, give our information, our bios, etc. And the other thing that the league has done for our hospital is given our CEO and others an opportunity to talk about bonds. And I'll talk about that in a minute. So that's been very helpful in terms of educating folks. And that's what our last bond did for us. We were able to do a lot of education about the hospital. So my role is, just as the video described, we have a strong fiduciary responsibility, planning responsibility, certainly governance, policy setting, policy direction. We just recently hired a brand new CEO after our beloved one retired after 30 years. And so there's been a lot of involvement from the Board of Commissioners as a result of changes that have occurred with the hospital. So another thing I wanted to mention that coincides with what Cynthia was saying is Whitman County, which is the county in which Pullman resides, has 4 hospital districts. So her special purpose description is very true for our county. We have 2 hospitals, Pullman, Colfax, and then we have an EMT district in one of our tiny little towns, and then we have a clinic. So it's, so we have 4 districts basically, but for different purposes. And, that's a great way to serve the needs of people, to be able to identify, and then you get those core group of people that feel really strongly, and they rally the troops and they make it happen. But then you've got to finance it, and that's where the rest of the community needs to come in and support. So we just passed an expansion bond. Again, 3 times was the charm. And this was a $27.5 million ask of our community. And our district is just within the city limits of Pullman. So that's who we were asking. And by golly, it was like a 76% approval rate, which we were like, whoa, that was spectacular. So the expansion will give us the opportunity to increase space for our existing services, as well as bringing in new specialties. And so I suspect this is very true for other public hospital districts. We have been asked by physician practices to take them on. We have been asked to acquire them and own them, because doctors do not want to be business people as a general rule. They want to treat patients. And so we own a number of practices through the hospital. And we're starting a WSU medical school residency program. And we'll have 3 residents actually housed in Pullman, working in a clinic that we just designed in our hospital. So that kind of stuff is going on. And I'm not sure that if you're not a public hospital and don't have the support of your community, that you would be able to take on some of these projects. I think that's a huge advantage that we have. The other thing is that we have the trust of the public, or they wouldn't fund us. And the commissioners are known to the citizens. And so, they don't always agree with what we come up with, believe me. They do not, but at least they feel like, okay, I know who I can call. And so it's not some obscure, board member in some other state. It's right here, local people who live here, work here. So I think that's a big advantage. And and it's a very complicated business these days, as you well know. Reimbursement is become very, very tricky. And Cynthia was absolutely right. The tax portion of what we get is very small and that's something that the community really needs to understand, and what their personal obligation is going to be. That's all part of the education that we had to do to pass this bond. So we are hugely reliant on, our third-party payers, Medicare, Medicaid, the whole thing. And we have a foundation, and we're also very reliant on fundraising through the foundation. So that's a lot in a nutshell. And I'm happy to answer any questions. I feel like our commissioner, it's just a wonderful role. If you're interested in healthcare in your community, it's a great way to really get involved and to really feel like you can make a difference, but also to be able to encourage other people to speak up. We've had many community forums, small group talks where, it's a one-on-one kind of conversation. What's important to you in terms of healthcare? What do you think the needs are? We have the ability to do that. And so I think, then people are invested in the healthcare of your community. They don't feel like someone's, out there making decisions that don't relate to them. So anyway, that's my spiel.
Thank you, Tricia. And I will go back to questions. I want to remind, Cynthia was not able to join us at the beginning, but and I hope everybody else was here for Jessica's presentation. Again, I want to remind everybody this is being recorded, and it will be available on our website in the public section, so that anybody can see this meeting. And that includes Jessica's presentation about what some of the issues that the public health district is dealing with. And she, as she told us, they have already decided to do a deeper dive on healthcare needs and accessibility and availability here in the county. And that is a huge information data collection opportunity for all of us. And so I think we really want to stay engaged and make sure that the stakeholders that we are aware of in the league are part of that conversation as we look at assessing the needs here. But I want to go on with the questions. I know Carolyn has her hand up, and there may be others. Carolyn, why don't you go next?
Well, Tricia made a really good point about, I think besides people mixing up hospital districts and health districts, I also think they mix up because of the name of hospital district. You think you can only have a hospital,
Right.
and that's not true. And Tricia made that very clear, that you can start with a pharmacy or, a clinic or, or a long-term care facility, any of those things. But my question is, because you said there were 4 hospital districts, I think you said within some Pullman or something, and they all did different things. But my question is, can you have those different things within one hospital district, or do you have to create a hospital district for each separate entity, like a hospital versus?
Yeah, these 4 districts, they're in the county. So it's not Pullman. So we're the only hospital district in the city of Pullman. Then Colfax has their own hospital district. And then the 2 small towns with a clinic and EMS, they had to create a hospital district to be able to get tax funding for the service that they felt was most important to their community. So that was EMS and then family practice clinic. And so, yeah, those are they're their own entities with their own boards. And yeah, and they function under the same laws that, open public meeting laws, that sort of thing, as the hospital does. Yeah.
But I guess my question is, they probably did that because they were outside of your hospital district, right? Because it's a geographic thing. Had they been within, had there been a group of citizens that wanted those special needs things within your hospital district, could you have done that as well as a hospital? Can you have more than one type of service you provide within the same hospital district?
Yeah, but it would be within the hospital district, right? So, we deliver EMS through the city. So I think what would happen is there probably would be other governmental resources that would serve that role, is what I'm thinking. And clinics, in our case, because we're a bigger city, we have private practitioners, and then we have clinics that the hospital owns. So that, we didn't need to create a separate district to do any of that. It's part of we're Whitman County Hospital District 1A.
Yeah.
So yeah, we're able to do that within our own district. They had to create their district.
Right, because they were outside of your geographic area.
Exact, because ours is very confined to the city limits of Pullman.
So you could start the clinic and then morph into something else, or you could start with something else. And, because obviously you're not going to start with a hospital, build a hospital right off, right?
No,
That's
and I think it's because here's what happens with these small towns. They have a certain pattern of where they go for their care. And so depending on where they're located in the county, they already have an established system that they go to. Pullman, with these two communities, wasn't it. They go to Colfax, or they go to Spokane, or someplace else. So it didn't make sense for them to, and it wouldn't have been approved anyway, because they wouldn't have met the criteria. Their population is way too small to meet state criteria to establish a district. So, but this was a need that they had to fill, and this is how they did it. So,
Could I just Could I just add one dimension of this? There are different scenarios. So one of them that was asked earlier was, what happens if the existing public hospital district wants to expand services to some other category? And we've talked about that. And then we've talked about the case where different parts of a county want different kinds of services and they create their own. There is also the option for any public special purpose district to annex another area. And I just want to clarify that that's perfectly acceptable and not unusual. But what that does require is a vote of the area to accept it, and a vote of the people who are being proposed to be added. So a brand new proposition would be put forward to expand, and it would be like another annexation. So I just wanted to clarify that that's also an option.
Yeah, thank you for bringing that. That happened to us when we were trying to pass our bond. We were told, wait a minute, we've got people outside of Pullman that are utilizing the services. Why aren't they paying taxes for Pullman Hospital? And so we said, okay, we hear you. So we did. We did float a bond and asked them, do you want to be part of our district? It was to be annexed to the Pullman Hospital District. And 1,600 people were eligible to vote, and they said, no, thank you. So yes, thank you, Cynthia, for reminding me about that. It is definitely possible.
Yes, thank you. I was going to say the same thing, because I know that happened in Kittitas at some point. And they also failed their annexation, by the way. So it's not all roses. Tricia, there's a question from our colleague, Jody. I don't know, Jody, if you're somewhere where you can put your video on and wave your hand so others can see you. Jody's question is in the
There she
chat.
is.
Hi there. Yeah.
Hi.
And she has a great
job,
question.
y'all.
Yeah. She has a great question. What is the proportion of federal reimbursement to private, the payer mix in Pullman? Do you have an idea, Trish, off the top
No,
of your head?
Yeah, all I know is we are our private insurance is more lucrative, for lack of a better word, than our federal reimbursement. We are very fortunate in a college community where people have private carriers through their employer. Schweitzer Engineering, same thing. They've got these private plans, and they are by far more of our financial packet, our base, than Medicare or Medicaid.
I think that's important to mention because it really plays a part, in how well a more rural, and you're less rural than a lot of places we'd be talking about. So I think it's just an important topic to bring up when we're talking about
Absolutely.
communities that may be doing this.
Well, we're aware of communities like Othello, for example, on these who are very dependent on Medicaid. Well, Medicaid does not reimburse to cover
Right.
costs. They don't. So yes, hospitals like that are dependent on Medicaid in particular are struggling. We're
Mhm.
fortunate because of the payer mix. That's yeah. Thanks for bringing that up.
Sure.
Okay. Whoops. Yes, I'm still unmuted. I never know what I've done. So I know there's a question from Ann Piles, but I wanted to go to Ann Blair. Love you both. They're regular members of our committee. And I know Ann has a different work experience. She knows a little bit about, Ann Blair knows a little bit about public special purpose districts. But go ahead and ask your question, because Cynthia's going to need to leave.
Thank you. Well, Lenny, thank you. I was just curious, and this is probably based on the experience I had in running a special purpose district for 7 years as the executive director. But what I'm wondering is, do you have, or are you aware of any in the state of the special purpose districts that are in partnership with a hospital that exists or with the local government entity, say the county government entity, so that it's a partnership in terms of maybe some funding is what I guess I'm thinking about, bond coverage, that kind of thing.
Cynthia,
would that be like an MOU arrangement, or?
Well, it could be. I mean, it definitely, that's how it would be established. But I'm just thinking that, if for example, and the one that occurred to me was, if there were a hospital that did not provide some services, but there were a way to work in partnership so that the hospital could maintain their limit or whatever services they provide, but it would be like a clinic, but a clinic that was affiliated in some way, probably just by physical building or, some sort of a funding partnership. Has anything like that been done, or that you're aware of? Because I mean, that seems to me to be a possibility, or to use the bonding capacity of the county or something like that.
Yeah, I'm not aware of that, but let me tell you what is possible and is done in terms of partnerships.
Mhm.
And it's a little tricky because it's
They always are.
Yeah, it's across state lines. So yeah, we owned a surgical practice and a specialty clinic practice with both the Colfax Hospital and in Moscow, Gritman Hospital. So we had, it was a limited liability, an LLC. And so all our physicians that were employed through that corporation would serve all three hospitals.
Okay, that's right.
Well,
And so there are examples
yeah,
of unusual ways of putting it together.
yes,
Because I think partnerships is they are tricky, but I think it's very satisfying. It's also really practical sometimes.
Yeah, we
Sometimes it's not. It's just
basically
too hard.
we wore the physicians ragged because
I
they
was
were
just
going
gonna
to.
ask that.
That was the downside for the docs. Yeah. So
Okay. Well, I'm thinking administratively and financially as much as thinking in terms of the personnel, but thank you. Okay.
sure.
Thanks. Yeah, and thank you. Are there any questions that Cynthia's going to need to leave? So if there are questions to go directly to her, and could have been partly answered by Cynthia too. Do you have anything to add before you leave, Cynthia?
No, I think Anne's had her hand up for quite a while though, so.
Yeah, I'm going to go to Anne next to make sure is this a question for Cynthia in particular?
It could be. I was just wondering, in all of those the hospital districts, are there any that are county-wide, or are they just limited, much more limited in geography?
I don't actually know.
Yeah, all I can speak to is Whitman County, and they are definitely limited in geography.
Looks like Jody knows. She did a lot of the research.
Yeah, Jody?
I do know that just offhand that Jefferson is that in that situation. Now that they have 2 public health. I don't know.
I think.
I'll check and see.
I may be wrong. I know Clallam has 2, right?
Yeah, pretty sure Jefferson only has 1. It's one of the unique ones.
Okay, thanks. Carolyn?
Yeah, one of the partnerships I think I've heard of is, and it might be Edmonds or Everett, where the hospital district owns the building and the services are provided by a different entity. In this case, I think it might be Providence, or one of what. And so the entity that is the actual hospital provider has to go along with the requirements that the hospital requires them to do, which makes them provide all of the services. And this was an issue recently. I don't have all of the details, but I know that is a partnership that has occurred in our area.
Okay.
Nancy, do you have, you're still muted.
I was just going to mention that, first of all, this is wonderful to see some of the material we've worked on presented so beautifully, and Lenny and Cynthia deserve a lot of credit in doing that, and certainly Tricia's willingness to volunteer and talk about her role is enriching this experience, and it's kind of wonderful to see some of the results of our work over a number of months coming to actually be presented. But I was going to say, Cynthia talked quite a bit about the source of funding when the idea of a hospital district is just getting started. And I know that there's one example, there was HRSA funding, which I think is Health Services Research Administration funding that one or more of the hospital districts used for their initial consulting over on the San Juan Islands. They actually got a planning grant. And I think that could be another example of a source of funding. You might have to do some matching, but they provide some examples of how that work has been started in some nearby counties.
Yeah, and I think because we have this recorded, looking again and again and again at that map, which is also available on some of the other resource sites we mentioned, is really helpful because public hospital districts get added. The one I'm most familiar with being, I'm not even sure how they're operating just yet, but Vashon Island is a brand new public hospital district, and there's another one that's only a little bit older than they are, and that may be the one in the San Juans. I have trouble keeping everything straight because there's really a lot of good resources out there, and we will have a PDF of the slide deck that I will share with the committee and those of you who are here today as well. I'm not sure, since we're going to put the video on the website, I'm not quite sure exactly where we'll end up with the extra information, including any links that people put in the chat and so forth, but I will try to make sure we get all that stuff out to everybody. Cynthia has had to leave, so if there are no more questions, I'm going to close the meeting, the presentation part of our meeting. And I have a question for the Healthcare Committee. If those of you who are on for that would stay on for a minute, that would be great. But thank you all for coming, and great questions. I really, really appreciate everybody coming for this. Thank you.